Plus project linking and analyzing data on deaths in U.S. prisons. My name is Sam Grossman, and I did this project with Ramil Mammadov and Jonathan Ross. To introduce our project, we are working as part of the Third City project. To complete this project, we are assembling death reporting data from all 50 states and different territories in the U.S. We're trying to compile an extensive database of all deaths that happen within prisons throughout the entire U.S. and complete data analysis with that data. We're doing this to fill a reporting void left by the Death and Custody Reporting Act in 2013's with the Department of Justice not enforcing it. Our objectives are to expand the Third City Project database using Department of Corrections press releases from all states in Washington, D.C., analyze prison mortality trends using data analysis with the Third City Project database, and build an interactive map to visualize prison deaths across the U.S.
Thank you. I'm Jonathan Ross, and today I will be covering the limitations we face during this project and the data sources we utilize. While this project improves public understanding of prisoner deaths by linking multiple data sources, it operates within a fragmented reporting system. Inconsistent reporting practices across states and missing data made it challenging to get a complete national picture. Some key barriers we faced included incomplete or delayed records, inconsistent terminology and formats, missing demographic and cause of death data, and underreporting of deaths in many jurisdictions. We mainly had 3 data sources that we used during this Third City project, and the first would be the state press releases manually entered through Qualtrics. Secondly, standardized records from the Bureau of Justice Statistics, and lastly, more recent data from the Bureau of Justice Assistance through reporting formats varied across states.
Thank you, Jonathan. Hello, my name is Ramil, and I will be presenting the data and visualization portion of our project on prison mortality in the United States. My focus includes exploratory data analysis, a state-by-state comparison using 2019 data, the development of an interactive map, and a preview of our next steps. We began by analyzing BGA data from 2020 to 2023. One of the clearest trends we observed was a spike in prison deaths after 2020, likely driven by COVID-19 and limited access to medical care. While the numbers dipped in 2022 and rose again in 2023, it's possible these fluctuations reflect reporting delays rather than actual change in mortality. Additionally, we can see from the chart here that over 50% of all deaths occurred in just 10 states, with Texas, California, and Florida leading. Racial disparities were also evident. White and black individuals accounted for most deaths. The majority of these deaths involved men, which aligns with their high representation in the incarcerated population. Over 70% of deaths were among non-Hispanic individuals, though it's worth noting that ethnicity data was missing in about 20% of cases. When we are looking at causes of death, most were attributed to natural causes, occurred in older prisoners, and happened inside state prisons, suggesting that chronic illness and poor access to care are key contributing factors. To gain historical context and better understand state-level variation, we also analyzed 2019 data for a comparative overview. While Texas, California, and Florida had the highest total prison death and populations, states like Louisiana, Mississippi, Oklahoma had the highest incarceration rates, and Alabama, Vermont, Arkansas had the highest death rates per 10,000 prisoners. This highlights an important insight. Larger states dominate in raw numbers, but smaller states can appear worse when adjusted for population, underscoring the value of rate-based comparisons. To make these findings accessible and transparent, we developed this interactive map, which shows the prison deaths and incarceration data by state and year. When you hover over a state, the map shows 2 panels, black and white. One displays general demographics like population size, age, gender, and race. The other shows prison-specific data, including total death rate, and imprisonment rate per 10,000 people. This tool supports the Third Cities project's mission to improve public access to prison mortality data and enable deeper policy and public health analysis. In conclusion, taken together, our analysis and tools reveal important disparities in how and where prisoners die, shaped by race, age, geography, and access to healthcare. With federal reporting gaps since 2019, this work helps fill a critical void in understanding prison mortality. Moving forward, we plan to link state and federal records, finalize and analyze BGA data 2020-2024, refine and publish the interactive map based on BGA dataset, apply machine learning and statistical models to explore trends, collaborate with third city representatives to improve the platform and draft a policy brief. Thank you for listening.